Why is hearing assistance so important? Are you aware that more than 70% of Australians aged over 70 have some degree of hearing loss? This increases to around 80% for people in high care. However, only about 1 in 4 of the people who need hearing aids wear them. Even a mild to moderate hearing loss can significantly interfere with easy and assured communication, especially in the presence of background noise.
This is a simulation of the type of hearing loss prevalent amongst aged people.
Imagine the addition of typical aged care facility background noises, for example, a heavy-duty vacuum cleaner or dining room noise. Background noise is #1 enemy of the hearing impaired. Let's hear from some hearing impaired residents in aged care what it's like to have a hearing loss.
If you're with other people, I don't take as much notice of it because I think I just keep quiet. I don't bother joining in the conversation, knowing that I'll probably annoy somebody if they knew I couldn't hear them. Because some people get very impatient if they've got to talk louder, and you get embarrassed yourself. I don't listen to the TV at all. Well, I had it on loud, but I didn't think it was that loud. And one of the girls came up and said, "Everybody's complaining about the noise you're making." I have it on really for company, just to see it. If I mostly read, but I don't watch it at all now because I can't hear it. It makes you feel as if you're getting worse and worse, and nobody will be bothered with you if you keep it up. It's something you want to get better.
It is distressing, especially when I get in a crowd. Even a number like that's in my dining room, everybody's talking and you still get that interference. You want to withdraw, straight away. I have had it said when I've said, "I beg your pardon, I beg your pardon," and somebody there would say, "Don't take any notice, she's deaf." That's a put down as far as I'm concerned.
Well, I just wasn't hearing anything, so I just felt left out of any conversation. I could not hear anything. And my daughter used to say, "Mum, you are missing such a lot." I said, "I know." That stopped me from going out a lot, because what pleasure was I going to get out of it because I could not hear it? So, ending up staying at home. People don't know that you're deaf, and they don't speak out loud. So you answer them and you hope it's the right answer. Well, half the time it's not. So isolation, it's terrible.
Well, you're just in another world of its own. There's no communication with other people because you can't understand what's being said. And that's just a bad influence on you itself. Well, when you're in a group, if you're not hearing, you can't converse with them and talk. You feel as if you're frightened of saying the wrong word. If they was to speak plain and not too fast, and that they don't mutter, and you get others who mumble. And one of the worst ones is people who talks too fast. You can never grasp what they're saying. Hearing aid helps a great deal because if you haven't got your hearing aid, you're missing out with what's happening around in the world.
It's clear that some of the most unfortunate side effects of hearing loss include frustration and embarrassment, leading to social withdrawal, and thus to isolation. This can worsen depression and dementia, and sometimes be confused with severe dementia. Hearing loss is often said to be an invisible or hidden disability, but close observation of certain behaviours can indicate the need for a hearing test. For example, frequent requests for repetition, loud volume of TV or radio, difficulty understanding conversation in groups or in background noise. It's important that you keep a close watch for residents exhibiting one or more of these behaviours and encourage them to have a simple screening test. An extended list of such behaviours is included in the Good Practice Guide. The earlier that hearing loss is recognised and, where appropriate, hearing aid use commenced, the more likely it will be that a person can adjust to wearing hearing aids. Otherwise, the sudden loud return of many forgotten sounds, especially in background noise, can be overwhelming and result in hearing aid use being abandoned. However, with hearing, it's a matter of use it or lose it. Friendly encouragement from staff may help new hearing aid users to persevere. Communication is a two-way responsibility. Simple techniques will greatly help hearing impaired people to understand what you are saying, whether or not they're using hearing aids. The techniques we will demonstrate are also listed in the Good Practice Guide. First, get the listener's attention. Reduce or move away from background noise. Turn off the radio or television. Face the listener directly. Both sit or both stand about a metre apart. Don't shout. Speak normally. If necessary, a little louder. Shouting and impatience will worry and distract the listener. A smile can be reassuring to the listener. Have light on your face, not shining in the listener's eyes. Keep your hands away from your face. Let the listener see what you are saying. Avoid waving your hands around. Do not distract the listener. Pointing to an object may give a clue as to what is being talked about. If other people are present in addition to the listener, position yourself close to the others. This will make it easier for the listener to follow the conversation. If the topic of conversation changes, give a clue to what is being talked about. Have a pen and pad handy to write notes as a last resort. If something you say is not understood, find another way of saying the same thing. This will give the listener a different and hopefully easier combination of sounds to hear. Be aware that a listener may have difficulty understanding speech, even with a hearing aid. It's important to realize that hearing impairment is a very individual experience. When hearing loss is associated with aging, it usually affects high-pitched sounds first. This makes consonants harder to hear than vowels. It is consonants that give words their meaning. Take this quip for an example. An X-ray of my head found nothing. Now reduce the consonants and look what's left. Even with lesser degrees of high pitch loss, reduced consonants makes understanding difficult. This explains why using different words may help, but shouting won't. Context is everything. It is sentences, not individual words, that give meaning to speech. So don't speak like this to a hearing impaired person. If a verbal communication doesn't go well, we should ask ourselves, what might I have done differently? Effective communication on your part is just as important as a well-functioning hearing aid.
Hearing aids are expensive and easily damaged, so handle them with clean, dry hands over a soft surface in case the aid is dropped, and never over water. Aids can be damaged by heat and moisture, so they should never be worn in the bath or shower or under a hairdryer and should be taken out when in bed. Hearing aids are exposed to body warmth and sweat when worn. If moisture regularly accumulates in the mould or tubing, it may help if the aid is stored in an airtight container with a drying agent, available from a hearing services provider. Hearing aids pick up sound, make it louder, then send the amplified sound into the ear. Basically, there are two types of hearing aids: behind the ear aids, or BTEs for short, which are the most common and easily managed. BTE aids have a detachable mould. The other type of hearing aid is an in-the-ear aid, or an ITE for short. Some aids have more than one program. When the aid is first turned on, it will be on the general setting. This setting should be appropriate for most situations, except for where a telecoil is required. Telecoils can be used with some telephones or in looped community areas. More detailed information on telecoil usage can be found in the Good Practice Guide. Some hearing aids have a preset volume, or one that varies automatically, depending on the surrounding situation. For example, if there's a lot of background noise. When the aid is switched on, it will come on at the volume that is suitable for most situations. If volume changes are needed, consult the hearing aid instruction booklet supplied with the hearing aid. If the aid whistles continually, and this can only be stopped when the volume is reduced, contact the hearing service provider. Most devices will have a wheel with which to change the volume. On a BTE aid, turn the volume control up towards the ceiling to increase the volume, and down towards the floor to decrease the volume. On an ITE aid, turn the control towards the face to increase the volume and towards the back of the head to make it softer. Before inserting an aid, wash your hands with water or alcohol wipes and ask permission of the resident. Report any signs of blood, discharge or broken skin to your supervisor. Aids should be turned off during insertion. Check the colour indicator to ensure that the aids are inserted in the correct ears, red for right and blue for left. To insert the ITE aid, make sure the aid is the right way up. Usually the removal line or air vent will sit in the forward bottom corner of the ear. Make sure the curve of the aid follows the curve of the ear. Give the earlobe a gentle pull down to make sure that the aid is seated correctly in the ear. Close the battery compartment to turn the aid on. If the aid whistles when turned on in the ear, repeat the insertion process. To insert a behind the ear aid, insert the mould into the ear canal, gently but firmly twisting the mould towards the back of the head, making sure that the top of the mould goes under the lip of the ear to avoid discomfort for the wearer and possible skin irritation. If it whistles, try to settle the mould better into the ear. Sometimes lubricant is required to correctly position the mould. Contact your supervisor in this case. After an aid has been inserted and whistling stopped, take a step back and possibly turn aside from the resident, then ask a straightforward question in a normal voice to check that the aid is functioning satisfactorily. Before removing an aid, turn it off. Gently withdraw an ITE aid by pulling on the removal line, if there is one, and lifting it up as you take it out. Before removing a BTE mould, turn the aid gently forward and lift it slightly clear of the ear, then gently withdraw the mould. Hold the mould rather than pulling the tubing, which may become detached from the mould. For both ITE and BTE aids, leave the battery compartment open and place the aid in its box or dehumidifier container. This helps to dry out the moisture from the aid. Ensure that the battery stays in the battery holder. Aids may not work due to an earwax blockage. Some BTE moulds have two holes in them. One is an air vent and the other is to send sound into the ear. If possible, brush or pick wax out of the holes in the BTE aids mould using a cleaning tool. Wipe wax onto a tissue for disposal. To avoid the possibility of cross-infection, a cleaning tool must not be used for more than one person's aids. A cleaning tool can be obtained from the hearing services provider if necessary. These are the cleaning tools. This tool with the brush has a little pick at one end and the magnet at the other end to help you get the battery out. This other little tool is a cleaning tool for the vent, which may be in your mould, or you may have a vent in your ITE hearing aid. Clean the outside of a BTE mould or an ITE aid with a tissue, damp cloth, or preferably an alcohol wipe. Never use the same wipe on another resident's aid. If frequent removal of wax from a mould or from an ITE aid is necessary, document and report this to your supervisor, as wax may need to be cleared out of the wearer's ear canal by a registered nurse or doctor. If an aid is not working, check to see if the aid is turned on, if the tubing or mould is blocked with wax or moisture, or if the battery is fresh. Flat batteries are the most common reason for aids not working. Cup the aid in your hand. If it whistles, then the aid is functioning. If it doesn't work when the aid's inserted, the cause is likely to be wax in the ear canal itself. The battery compartment is at the bottom of a BTE aid. Remove the battery with the magnetic tip of the wax cleaning tool. Don't bang an aid to remove the battery. Dispose of the old batteries in the rubbish bin immediately to avoid possible confusion with a new battery. It's a very easy mistake to make. Different types of aids take different sized batteries, so be sure that you use the right size. Pick up a new battery with the magnetic tip of the wax cleaning tool, the plus sign on the battery facing up. Never force a battery into the compartment, as this may damage the casing. Close the battery compartment carefully. Open the battery compartment of an ITE aid, then remove or insert the battery in the same way as for the BTE aids. When a new battery has been installed in either type of aid and the battery door has been shut, the aid is turned on. Cup the aid in your hand and hold it up to your ear where it should whistle, indicating that the battery is okay. When people need assistance to manage their aids, it's necessary to have a record of at least the type of aids and assistance required, the battery size, and the hearing services provider and their phone number. Batteries should be changed regularly on the same day each week, preferably, even if they're still working, and more frequently if necessary. It's a bit like the dimming of a torch bulb as the batteries run down. Most hearing aids can be set with a warning beep to alert the wearer that the battery requires changing. However, some aged people may not recognise the warning signal. The routine weekly battery change may best be performed by a nurse who has the skills for hearing aid management and minor troubleshooting, including checking for blood, discharge or broken skin in the ear, checking that the mould and tubing are not becoming stiff and need replacing, checking for possible corrosion on the battery contacts, checking ear canal for possible wax blockage, and washing the BTE aid moulds to remove stubborn wax blockages. From time to time, nurses may need to attend to the following matters. Check if the battery contacts are corroded. If so, clear the compartment with an alcohol swab. If it's still not working, send the aid to a hearing services provider for repair. Clean the moulds of a BTE aids if wax cannot be removed with a cleaning tool. Detach the mould from the aid by carefully pulling the tubing off the hard plastic ear hook. Leave the aid well away from water while washing the mould. Wash the mould in warm soapy water and rinse in running water. If both of a resident's moulds need washing, do one at a time to avoid possible attaching the mould to the wrong hearing aid. Dry the mould and tubing thoroughly. Tap the mould on a soft cloth to dislodge any moisture. Preferably use a small puffer to ensure that all moisture and wax is removed after washing. Puffers are available from hearing services providers. Reattach the mould to the aid, ensuring the curve of the aid and the curve of the mould follow the same line. To clean wax from most ITE aids, use the wire loop on the cleaning tool to remove the wax. Never use a pin, needle or cleaning wire for this purpose, as it may damage the aid. To assist with ear mould insertion, try placing a small smear of water-based personal lubricant on the sides of the mould, being careful that it doesn't get into the holes on the end of the mould or the ITE aid. To avoid possible cross-infection, don't let the tip of the tube come in contact with the mould, particularly if the lubricant is being used for more than one person. Should a hearing aid get wet, open the battery compartment and allow it to drain. An ordinary fan may aid the drying, but never use a hairdryer. Leave the aid overnight in an airtight container with a drying agent and check the function the next day. If the aid is still not working or sounds seem low, send it in for repair. Increasingly, small light BTE aids are being fitted. These have very narrow tubing and small domes instead of moulds. The domes and tubing can be replaced every 6 weeks. The hearing services provider that supplied the aids can provide the right size tubing and domes for the individual user. If the tubing or mould of a BTE aid has been replaced by the hearing services provider, a mould with an attached length of tubing may be mailed back for reattachment to the aid. Insert the mould into the ear correctly, then place the aid over the ear in the correct position. Mark the tubing with a pen, allowing sufficient overlap over the lip of the ear hook, about 5 mm. Remove the ear mould from the ear, cutting the tubing on the higher side of the mark. Do not cut the tubing whilst the mould is in the ear. When attaching the aid to the mould, ensure that the curve of the mould matches the curve of the hearing aid. Sometimes an assistive listening device, or ALD, is fitted instead of hearing aids. An ALD may be suitable for someone who is unable or unwilling to use hearing aids. If necessary, its use can be initiated by a visiting family member, medical practitioner, or by a staff member to make communication easier and more reliable. For example, a personal amplifier is small, lightweight and simple to use, as explained in the user manual. Cochlear implants will increasingly be encountered in aged care facilities for people with a severe to profound hearing loss. The external sound processor may look similar to a BTE hearing aid. The sound processor may have a remote control. The coil transmits digital signals from the external sound processor to the implant. The transmission coil is held against the outside of the head by magnetic attraction between the coil and the implant, which is under the skin a little behind the ear. Tiny electrodes deliver impulses from the implant to the cochlea in the inner ear, which stimulates the auditory nerve to the brain, thus bypassing the damaged hearing mechanism of the ear. It is becoming common to have implants for both ears, so the user has a sound processor on both sides of their head. A sound processor must only be used for the correct ear. A cochlear implant does not have problems with whistling or wax accumulation, as it doesn't have an ear mould. However, a sound processor may sometimes have a snug fit attached to help secure it to the ear. Finally, hearing aids can be expensive to purchase. In Australia, we have a government hearing services program for eligible people, including most pensioners and veterans. The Hearing Services program provides hearing aids at no cost and batteries and repairs for a small annual fee. If a resident's aid is damaged beyond repair, it can be replaced for a small fee. For further information, see the Good Practice Guide.